Welcome back. July marks the start of Sarcoma Cancer Awareness Month. Here to discuss the effects this disease has on people throughout our country is Dr. David S. Geller, co director of the Orthopedic Oncology Division at Montefiore Health System and professor of orthopedic surgery and pediatrics at Albert Einstein College of Medicine. Doctor, thank you so much for joining me.
My pleasure. Thanks for having me.
Now, can you tell me about the Montefiore Einstein Center for Cancer Care Melanoma Sarcoma program?
Sure. The program is really a compilation of a lot of different specialists that come together. They each bring their own expertise and their own, skill set, and we work together as a team to try and tackle some of these really tough problems.
Now, I think to better understand this, and I understand that this is not a cancer that a lot of people know about, can you just explain what sarcoma cancer is and how it affects your health?
Sure. And just to go back to the original question, melanoma is a type of skin cancer, and it's got its own set of kind of rules and paradigms. Sarcoma is a type of cancer that arises from some sort of connective tissue. It could be bone, it could be muscle, it could be fatty tissue. There's actually over 50 different kinds of these cancers, and although there are some common treatment approaches, sometimes there are differences depending upon the subtype.
Okay, so I'm really glad that you mentioned that because throughout my research, I'm just used to like cancer having like this, we kind of view it as this like overall type of thing, but there are so many different types of this kind of cancer. Can you tell me a little bit more about that?
Yeah, as we get better and better at discerning differences and understanding what drives and why some of these cancers begin, we're starting to categorize them, more accurately. And so, what we used to group together and lump together, we're now starting to split apart. And that helps us understand how these are going to behave and maybe treatments that are specific and particularly good for one subtype. So, some of the tools we use to figure this out include genomics. We look at the genetic drivers. What are some mutations that maybe turn these cancers on? And maybe some of the genetic mutations are also keys to figuring out how to best treat them. That's not always the case. And sometimes we have to use pretty standard techniques, whether it be things like surgery or chemotherapy, but we're trying to get more sophisticated in our approach and more specific in what we do and how we do it so we can balance out the treatment and then the side effects or the morbidity from those treatments. And finding that balance and trying to do as little harm as possible but still effectively treat the cancer is really the key to all of this.
Now, according to the American Cancer Society, when the word sarcoma is part of the name of a disease, it means the tumor is malignant. Can you further explain what malignant means? And I know there's like another word that's the opposite, but I can't think of it right now. But can you explain that further for us?
Yeah. So a tumor is any kind of growth, and it might be a pretty simple growth that's not very dangerous. That would fall into the benign category. That means that it can grow in one area, but it's not going to spread generally. And then there are tumors there that are malignant, and that means that they're cancers. That means that they can spread, and by virtue of being able to spread, they are a risk to people's lives if they're not treated. So um, often we can put a tumor into one of those categories pretty neatly. We either know it's going to behave along a benign course, or we know it's going to behave more like a malignant tumor. And then, of course, there are some tumors that are a little harder to figure out that might not be quite as clear cut. But generally speaking, if something's benign, it's treated one way, and if something is malignant, it gets a whole different approach.
Now, unlike many other cancers, this cancer does not affect one specific part of the body. Does this make it challenging to spot or to even look for signs or symptoms?
Yeah, indeed. It's a pretty rare tumor in general. If you look at all sarcomas, there's only a few thousand, maybe 15,000 or so a year in the United States. When you compare that to carcinomas, things like breast cancer or prostate cancer or lung cancer, there are hundreds of thousands of carcinomas. And what that means is it's sometimes very hard to pick up, and it's sometimes only picked up or detected once it's sizable. To further complicate things, many soft tissue sarcomas, so sarcomas that start in the muscle or the fat, they don't really hurt, and people tend to not worry about them until they're pretty big. That also makes things more difficult because obviously the longer it's there, the more likely it is to cause problems. And it's not really the kind of thing you can screen for because they're so unusual. So those are challenges that we have to contend with.
Wow. So if you're unable to screen for that, is it like how do you I guess make people aware, or how do they know if they have it or if it's something that they should even look into?
Yeah, great question. So generally speaking, if something is small, it's probably benign. I know it sounds very simple, but it's been pretty robustly shown that if something is smaller than, say, a few centimeters, maybe the size of a golf ball, it's probably benign. There's always exceptions to that. But if something is larger, if it's growing quickly, if it has any funny look to it, like it might be bleeding or ulcerated or anything like that, it should be checked out right away. In our practice, I have two partners. We have a pretty big program here at Montefiore, and we generally prefer to see patients with a small benign bump who are just being careful than to not have them come in and find out later that this was missed and it could have been picked up much earlier. So if you're ever in doubt, have someone look at it and evaluate it. It's always better to be safe than sorry.
I agree. Now, what is the most common type of sarcoma and who is most commonly affected by it?
Yeah. So sarcomas can affect any age group. I think that it depends a little bit on what kind you're talking about. If you're talking about soft tissue sarcomas, the most common subtypes probably what's called an undifferentiated pleomorphic sarcoma, or a UPS. And most of those are going to be in older patients, adults and older patients, in most commonly the thigh or the lower extremities. There are obviously other subtypes that have a predilection for different age groups, but we could spend a lot of time talking about all the different kinds and the different ages. Don't know if we have that much time.
Now, I'd really like to know what are the risk factors associated with sarcoma? Because I know for a lot of cancers, people will say, stay away from this. Or if you have a family of history of this, you should look for that. Do we see that with this type of cancer?
Most of them, no. There are very rare exceptions, certain um, family genetic predispositions, and certain, um, I guess, there are certainly a subset of patients who have a genetic predisposition for some of these cancers. But by and large, the vast majority of them arise for reasons we don't understand. We can't predict who will get one. And really, the best thing we can do is pick them up and treat them as expediently as we can once they're noticed.
Now, I know we talked a little bit about, briefly about symptoms, but what's something that you would tell somebody if they're not sure, or if they're just maybe they have a tumor or something small that they've noticed? What would you say to them, and what should they look for, and how should they seek help if they do notice something?
Yeah, so if you have a sarcoma in one of the bones in your body, that tends to cause pain because the bone gets eroded a little bit, it becomes a little less robust structurally, and so that can hurt. If you have pain that You notice when you're sitting or when you're sleeping, if it wakes you up at night. And if you feel like your leg or your arm is more swollen or warmer, that should be looked at right away. When it comes to soft tissue bumps and lumps, if they're larger than, let's say, a golf ball or a few centimeters or a couple of inches in size, that should be looked at. And if you have something that has been growing rapidly, so it's changing and getting bigger and bigger each week, you should have that looked at right away.
Now, I really want to know. I know for a lot of people, like you mentioned, if you feel a little pain, there's this kind of joke online that like you Google something and like the worst thing possible pops up. How do you navigate whether, okay, maybe I actually should go to the doctor or this is just the internet trying to scare me?
Yeah, the internet's really hard. It's a double-edged sword. On one hand, it really is a wealth of information, but it's sometimes hard to know whether that information is accurate. I think rather than trying to figure this out, it's always better to have somebody evaluate it. Oftentimes, in just a matter of minutes, we can, discern the difference between something pretty benign and pretty safe from something that is potentially concerning and potentially very dangerous. And it doesn't need to be a very complicated workup. It can sometimes be fairly simple. However, if you were to go to the internet and try to figure some of this out, make sure you're going to a reliable source. Make sure you're not looking at just an opinion piece or a personal anecdotal experience. I think you should look at an article or a website that's put out by a medical group that has experience with it and does this routinely day in and day out. That material is usually vetted, it's usually worded very carefully, and probably will give you a better sense of whether you ought to seek a professional opinion.
So we have about a minute left. Can you just tell me about Montefiore screening efforts?
Well, screening is tough. It's a little bit, for sarcoma, screening is difficult. Certainly, the melanoma program has a screening effort, and uh, that can go a very long way at early detection. And that's an effort that's undertaken by both dermatologists and surgical oncologists and other members of the team. Sarcoma is really hard to screen for. I think ultimately one day we hope to be able to do that, but it's not within our technical ability at this point. Our efforts at Montefiore are largely focused on three things. One is clinical care, and really that's the most important out of everything. We want excellent, top notch, outstanding clinical care for all our patients. We're dedicated to education. We have a residency and a fellowship, and we focus a lot on the next generation of clinicians. And finally, we have a laboratory. We do a lot of research because if we want to find tomorrow's cures, we got to put the work in and the effort today. And that is probably the hardest part of what we do. We spend time fundraising, we spend time raising awareness about sarcoma, and we try to uh, look ahead and find better solutions. We don't want to do next year the same thing we did 10 years ago.
All right, doctor, thank you so much for joining me.
It's my pleasure. Thanks for having me.
We'll be right back with more Open BxRx Tuesday.